Ectopic pregnancy brought to you by Discover Parenting. An ectopic pregnancy occurs when a fertilized egg grows outside of the uterus. Almost all ectopic pregnancies, more than 90%, occur in a fallopian tube. As the pregnancy grows, it can cause the tube to burst, rupture. A rupture can cause major internal bleeding. This can be a life-threatening emergency that needs immediate surgery. Symptoms of ectopic pregnancy. At first, an ectopic pregnancy may feel like a typical pregnancy with some of the same signs, such as a missed menstrual period, tender breasts, or an upset stomach. Other signs may include 1. Abnormal vaginal bleeding. 2. Low back pain. 3. Mild pain in the abdomen or pelvis. 4. Mild cramping on one side of the pelvis. At this stage, it may be hard to know if you are experiencing a typical pregnancy or an ectopic pregnancy. Abnormal bleeding and pelvic pain should be reported to your obstetrician, gynecologist, OB/GYN, or other healthcare professional. Diagnosis: ectopic pregnancy. It can be difficult to diagnose an ectopic pregnancy from the symptoms alone, as they can be similar to other conditions. Some of the tests you may have are outlined below. 1. Vaginal ultrasound. 2. Blood test. 3. Laparoscopy. Vaginal ultrasound. An ectopic pregnancy is usually diagnosed by carrying out a transvaginal ultrasound scan. This involves inserting a small probe into your vagina. This will often show whether a fertilized egg has become implanted in one of your fallopian tubes, although occasionally it may be very difficult to spot. Blood tests. This can be a useful way of identifying ectopic pregnancies that aren't found during an ultrasound scan, as the level of HCG tends to be lower and rise more slowly over time than in a normal pregnancy. The results of the test can also be useful in determining the best treatment for an ectopic pregnancy. Laparoscopy. If it's still not clear whether you have an ectopic pregnancy or the location of the pregnancy is unknown, a laparoscopy may be carried out. Your doctor uses the laparoscope to examine the womb and fallopian tubes directly. If an ectopic pregnancy is found during the procedure, small surgical instruments may be used to remove it. How an ectopic pregnancy is treated. 1. Expectant management. You're carefully monitored, and one of the treatments below is used if the fertilized egg doesn't dissolve by itself. 2. Medicine. An injection of a powerful medicine called methotrexate is used to stop the pregnancy growing. 3. Surgery. Keyhole surgery, laparoscopy, is performed under general anesthetic to remove the fertilized egg, usually along with the affected fallopian tube. You'll be told about the benefits and risks of each option. In many cases, a particular treatment will be recommended based on your symptoms and the results of the tests you have. Some treatments may reduce your chances of being able to conceive naturally in the future, although most women will still be able to get pregnant. What can cause an ectopic pregnancy? The following are all associated with an increased risk of ectopic pregnancy. 1. Pelvic inflammatory disease, PID, inflammation of the female reproductive system, usually caused by a sexually transmitted infection, STI. 2. Previous ectopic pregnancy, the risk of having another ectopic pregnancy is around 10%. 3. Previous surgery on your fallopian tubes, such as an unsuccessful female sterilization procedure. 4. Fertility treatment, such as IVF, taking medicine to stimulate ovulation, the release of an egg, can increase the risk of ectopic pregnancy. 5. Becoming pregnant while using an intrauterine device, IUD, or intrauterine system, IUS, for contraception. It's rare to get pregnant while using these, but if you do, you're more likely to have an ectopic pregnancy. 6. Smoking. 7. Increasing age, the risk is highest for pregnant women aged over 35. Help and support after an ectopic pregnancy. Losing a pregnancy can be devastating, and many women feel the same sense of grief as if they had lost a family member or partner. It's not uncommon for these feelings to last several months, although they usually improve with time. Make sure you give yourself and your partner time to grieve. When to get emergency help. If you experience a combination of 1. A sharp, sudden, and intense pain in your tummy. 2. Feeling very dizzy or fainting. Feeling sick. 3. Looking very pale. These symptoms could mean that your fallopian tube has split open, ruptured. This is very serious, and surgery to repair the fallopian tube needs to be carried out as soon as possible. A rupture can be life-threatening, but fortunately they're uncommon and treatable if dealt with quickly. Trying for baby. You may want to try for another baby when you and your partner feel physically and emotionally ready. You'll probably be advised to wait until you've had at least 2 periods after treatment before trying again to allow yourself to recover. If you were treated with methotrexate, it's usually recommended that you wait at least 3 months because the medicine could harm your baby if you become pregnant during this time. Thanks for watching. Like, comment, and subscribe.